Welcome to Orthodontic Smiles, the podcast designed for all dentists and their staffs who practice orthodontics. This podcast is brought to you by the American Orthodontic Society. Today on Orthodontic Smiles podcast, we will interview Dr. Joseph Yousefian. He is a diplomate of the American Board of Orthodontics. He's an educator, practitioner, lecturer, and author. But most importantly, he's an innovator. His immense knowledge of TMD and sleep disorders has made him a renowned leader in this life-threatening disease. His life has been filled with challenges, but he has persisted in his passionate goal of empowering the dental profession to recognize and treat airway disorders and sleep apnea. I promise you that this interview will change your perspective of how dentistry will change in the next 10 years. Remember, you heard it first on Orthodontic Smiles podcast. And now, an interview with this brilliant man. Orthodontic Smiles today wants to welcome Dr. Joseph Yousefian. We're at the American Orthodontic Society meeting in San Diego, where he was one of our guest speakers, and he wowed the crowd yesterday with his presentation on pediatric sleep apnea. What a wonderful lecture, and thank you for being with Orthodontic Smiles podcast, Dr. Yousefian. You are just incredible. What a wonderful lecture that was.
Thank you.
So I'm very happy to have you with us, and I want to know everything about you. I want to know how you started. I want to know your history. I want to know where you think we're going to be in 10 years with pediatric sleep apnea. So let's get started, and let's just say, all right, you're Dr. Joseph Yousefian. You're from Iran originally. So tell me how you got started in dentistry.
Well, I'm very good with my hands and always have been with my hands. I used to make jewelries for my sister, as a hobby, and so I wanted to pick something that is medicine, but I can use my hands. So dentistry fitted, that purpose very well. So I attended Tehran University back in Iran, and through my education started. And this was a very unique program that you start as a medical and then dental. We made it very, very kind of one of a kind. And this is the first one that was tried between 11 different departments at Tehran University. So it was involved with the PhD curriculum. Again, 11 departments coming together, and the focus of the research was on transferring factor that is kind of in charge of distribution of iron. So at the time, of course, this is late.
This is
70s.
This is after you got out of dental school.
No,
this is right in the middle of it. So you were actually doing PhD research in your dental school program. Amazing.
That's right. So, and then of course, 78 and 90, 79, 80s revolution at the Shah's time, which at the time I was on the bad list of the Shah, unfortunately. I have been on everybody's bad list. So then when the new regime of Khomeini as a leader came, and I was not, pro-government, and there were a lot of discrepancies that I didn't approve. So I was on the student body against the whole there was discrimination.
The whole revolution.
That's right. The way that was going on discrimination based on what we call religion, and anyway. So as a result of that, not wanting what I was proposing and was opposing, so they expelled me from university. So, and I was out. So
how old were you at this time?
And this is now 23.
23, young man.
So I didn't have anything to do. So I said that, well, Iraq at the time, invaded Iran. So I just joined as a volunteer, and I went to the front and started fighting. And I almost got killed there. But that was a good experience. A lot of, friends that got killed, and harsh time, but at the same time, it was meaningful in the life of a young person that is all for, a humanitarian, thoughts. So it taught me a lot. So the university opened, and, they accepted me back, let me defend my thesis. But then the curriculum that I had to finish in order to get my degree, they didn't let me do that. Actually, very soon, my professors, they said that, Yusuf, of course, my Persian Yusuf, you need to get the hell out of here, my friend, because they're coming after you. And matter of, at the time, now I'm married, just 6-7 months, that I got married with my dear love, Rosita, and I had to escape. So I, on foot, escaped to Turkey. And with no passport, I didn't have anything. It was so desperate situation. So I had to, live with Kurdish people for a while, and with no passport, finally I got to the Turkey, and unfortunately, just they captured me and they sent me back. I was in Alazikh jail for 6-7 months, and then the reporter out of nowhere reported that Dr. Yousefian is here in town, in prison, and a matter of few days, they called me. They said that they want to help me from the Persian or Iranian embassy, but they sent me back to Iran. So I was on the border the night, the time that next day they were going to send me back to, back in Iran, and they were saying that, okay, tomorrow is the time that they were going to shoot you to death. And you probably heard, Ed, about this story that the Pink Floyd tape saved my life.
We probably don't have time for that whole story, because it was like a 3-hour conversation we had about your life, and I'm still to this day, Joseph, think that you should put this down on paper in a book, and because I know that Hollywood would pick this up in a minute, the story you have. So it was a long period there where you were in prison, and then finally was able to escape, and then you went into Turkey. What had happened to you in Turkey, and how did you get back into dentistry after you got there?
Well, when I got back to Turkey again, second time, and by grace of God, I was saved. United Nations right away sent me to Italy, and then I end up in United States with no degrees, nothing, no money. So I had to, take the board, and I attended I took the national board, and then I went to Washington University in St. Louis. And it was a pleasure and honor being a student of Dr. Mohammed Marzouk. The program did not have the postgraduate anything, no orthodontic, no they had orthodontic, but no prosthodontic. So Marzouk made us the great, knowing everything about dentistry. So he trained my mind in prosthodontics. And then I graduated for that program with my DMD program, and did applying for the different programs for orthodontics. Had an interview, I remember, at Ohio State University with Dr. Zev Davidovich. What a pleasure, this, what we call working with Dr. Zev Davidovich. And he accepted me. He knew about my background research back in Iran, and he got me to the program, and we had great educational program there, 3 years. And I combined it with the anthropology and biology under the supervision of Dr. Shanfield and Dr. Schuler. They are both PhD, and I did significant amount of research on Adena Indians that lived in Ohio Valley 2,000 years ago, and what they used to do as a recognition, changing their faces with brachycephalization. And we wrote several chapters and book that published in the Harvard, what we call Orthodontic Society. So after that, what was thinking about residing somewhere in the United States, and Dr. Davidovich insisted that I stayed in the academic. And I'm very, very bad with politics. I knew that I'm not going to survive.
I can see that. I can see that. You didn't do very well in Iran.
So anyway, I heard about the nature and beauty in Northwest and Seattle. I never heard about it. And then I had a quick travel there, and I just fell in love with Seattle and Northwest. And that was the biggest mistake that I did in my life that made the best thing that ever happened to me. So make the long story short, I went to Dr. Shapiro at the time, chairman of the department, invited me to get engaged with the department, and I started as a faculty, teaching there. And of course, Dr. Shapiro retired and did not work as a chairman. The new chairman came in, and I don't want to mention the name, but anyway, this is the time that I noticed the thing that I was doing. I was getting some side effects. The biggest extractionist that you think about. I was making a lot of money. People, they come and I take care of their teeth.
So you were doing, almost all your cases were 4x extraction cases.
Headgear extraction. But at the same time, and I was treating TMJ by that. Some of them, they responded very well, but some of them, when I started 4 or 5 years, and I already passed my board, and I was very good at what I was doing, but I noticed that people, they come back and they have perfect occlusion, but TMJ still is lingering on the background, and now they're complaining of some other weird things that is happening. So I cannot sleep. I'm gaining weight. Education is getting affected. So it made me start thinking. At the time, of course, the issue of the sleep apnea and obstructive sleep apnea are now becoming a little bit of what we call curiosity. Dr. Gimino, back in Stanford, started talking about it, and I knew about obstructive sleep apnea. And then something strange happened, and my dearest thing in my life, besides my wife, my son, was in front of me, suffering from things that I never saw it before. So 6-7-year-old boy that was very, very smart, and I didn't do anything. I just watching him. I knew that something is not right. It's about age 9, 10, 11, he became significantly obese, developed a lot of issues, learning disability that he never had. So that made me curious, to the point that they told us that he's not smart enough anymore. Was hating athletic activities, hated to go to swimming pool because he was chubby, and hated that. So that made me think about what is happening to him and the kids like him. So a matter of curiosity, I just dug into this, and I noticed there is something else on the background that actually I can deteriorate by the anatomy I discovered, which is now published as pharyngo-orofacial anatomy. So it was something beyond orofacial and dentofacial and face. It was airway behind it. So I didn't do any of things that now I know about my son. It just we waited. At the time at the university, now I noticed that some of the cases that I have been doing extraction and fully retracting the teeth back, the airway is not happy. They didn't have a snoring, now they have a snoring. And unfortunately, not being a good politician, at university I started talking about it. I said, these cases that they come and be constantly extraction, headgear extraction is not right. Well, at the time, some more established faculties, they didn't like the idea. The younger faculties, Dr. Shapiro, Dr. Present, what we call chairman of the program, Dr. Greg Wang, they understand the concept very well. They understood my point of view and they appreciate it. But the older population or more established population of faculties, they didn't like it. And they said that, well, you're confusing the residents, so they expelled me again. My life had been expelled from one and another, organization. So anyway, and my life since then was ruined. And because they spread the rumor that this guy is weird, he has a weird office that He talks about airway, and he's talking about the expanding the airway and sleep apnea, non-extracting, so I was very, very secluded, and my office really dearly paid for it. I was making so much money, and now I cannot even pay my rent. So they expelled me again out of my building now. So I had to go and I had my office only, and for $4.2 million house that I had, it just gone. That was the punishment of, again, not being politically right. Mm-hmm. So, but that's what I survived, doing what I was doing. I just keep doing, and now I was a true believer on something that I call different from orthodontic. Orthodontic is a great science. It's the first specialty that ever in dentistry came as a specialty. But at the same time, when it was Edward Engel and mentioned about this science, it was all about expansion. And of course, there are things that was happening, and it has been happening. If you look at the Dr. Weston Price, work, amazing work that he did, and went through this what we call original traditional communities like Aborigines in Australia, and look at the transition that this population of one generation before exposure to civilization and one generation after, that exposure to an unaccustomed food, creating allergies, mouth breathing, and how collapse the faces of these. It fit my understanding that I developed during my anthropology education at Ohio State University, that the same thing that happened for the collapse of the arches because of the utilization of the softer food, non-accustomed food, development of the allergies, the faces and the bites are collapsing. And then these patients that, they were beautiful, broad nostrils and nasal breathers, they became mouth breathers, and arches are collapsing. Actually, that's the way that orthodontic kind of now is flourished, because we have crowded teeth. Let's get those teeth out and make the rest of this. So orthodontic originally was not intended for that, but then the influence of some other clinicians that make it easy, let's extract teeth, make the rest of them straight, it creates some problems. Well, there were research that was done by Dr. Bolton, and also later in the 1990s by Dr. John Warren, and also Bichero, looking at the Iowa study. They look at it that the last 100 years something very peculiar is coming to the whole civilization, especially industrialized countries like United States, United Kingdom, and that is again utilization of not only the softer diet that does not let the jaws grow. Actually, as a result of that, if you remember a theory of Moss, that soft tissue, it is encouraging to the bones grow. Now we are not using our muscles anymore. As a result of that, we are not training the jaws to grow normally and wider. Teeth, they don't have enough room. And also the other issue of the using pacifiers and not doing breastfeeding and using the bottle feeding, that in the last 100 years created significant deficiency in pharyngofacial environment and collapse of this environment. This is the environment that is important. It is what we call geared for breathing, supporting the breathing system, chewing system, swallowing, facial expression, and speech, especially when there is not enough bone and teeth support for this, and what we call the environment is collapsing. Patients, kids that they cannot breathe very well, they are mouth breathers, the tongue drops, the arches are narrowing. So as a result of that, the airway gets smaller and smaller.
So the tongue, once it starts to drop because they're not able to breathe, I always explain it as the tongue is the scaffolding for the upper arch. So if your tongue sits in its normal position, the tongue actually helps develop the maxilla into a nice wide position.
Absolutely right. And as a result of that, when these things are not happening, is the series of the catastrophic things that happen to this pharyngofacial environment and collapse of that. And unfortunately, as orthodontists, we learn that, get the teeth out, some teeth out, and get the rest of them straight, which was, it is contrary to what is physiologically is happening, and actually pushing them further to this disease that now we know that is obstructive sleep apnea. So as a result of that, I came up with the idea, and the idea was generated by surgeons. Ed, we need to accept that surgeons, they have something that maybe a little bit smarter than us. So earlier, the guy, clinicians.
We're speaking about oral surgeons.
That's right, oral surgeons. Right. And then maxillofacial surgeon, pioneers like Jeff Pencil from Pennsylvania, they came up with the idea of telegenetic surgery. So what does it mean? It's the same orthogenetic surgery, except pushing the jaw back. They purified the science. So it means that it's like vaccine. Vaccine, when it's generated, there are a lot of harmful components in it that is not good for you. So they need to get the proteins that you don't need and use the proteins that specifically for attacking the bacteria or, So they did the purification of the science of maxillofacial surgery. They noticed that they never set the jaw back because that ruins the airway. They always bring the jaw forward and came up with maxillomandibular advancement surgery, telegenetic surgery to cure sleep apnea. Well, let's think about it. Always, in order to do these MMA surgeries in dental, orthodontic programs, we learn orthodontic, orthogenetic surgery. So if it's the telegenetic surgery there, and as a result of that, I am avoiding extraction. And I'm expanding, like Ed, you were just talking about it, expansion of the jaws and palate with the tongue. So we need to use the what we call a strategy and technique that is going to be purified and get the things that they can be harmful for the airway out. I didn't like the idea of extraction and pulling the teeth back, or headgear effect appliances, like Herbst appliance. Herbst is another headgear type of, with the headgear result. Any distalizing appliances, unfortunately, all the functional appliances that there exist right now is based on the headgear effect. And Dr. Jim McNamara showed that they have headgear effect. Doesn't matter, is distalizer or those. Those are the ones that we need to purify from the science of orthodontic, which is the most powerful science for improvement of pharyngofacial environment. So as a result of that, I call it teledontics, moving the teeth and jaws to distance to open up the airway. And it goes hand in hand with the science of telegenetic surgery. So now there have been some misunderstanding about the telegenetic, that they saw that definitely jaws should come forward to call it telegenetic. But do you know what, Ed? We have created very simple technique of symphysial distraction. That's telegenetic surgery. If you do the SARPI, is another telegenetic surgery. If you do the periodontally accelerated osteogenic orthodontic surgery, that's another telegenetic procedure.
So let me stop here for those that can't visually perceive what you're talking about and don't know what you're talking about. But let me see if I can give an explanation. You correct me if I'm wrong. Basically, expanding the upper arch, the more you expand the upper arch, the more the volume of air can pass through the airway. But sometimes you're leaving the mandible behind. So you do a symphysis cut in the bone of the mandible, separating the mandible into two pieces, of course stabilized, and then you expand it to stay up with the width of the upper jaw. So the tongue has more room, the upper jaw has more airway, and then you do orthodontics to complete the process. Did I explain correctly?
Absolutely right.
Okay. So that's the process that you've pretty much developed.
Sure. And exactly. So that's what we call it teledontic telegenetic protocol, that it goes hand with hand. Again, is purified. So it means that we are moving everything away from the base of the skull and expanding the pharyngeal airway and upper airway. Anything that is a retraction of these teeth and constricting this environment is out. So we have been lucky. Well, the thing is that we have been talking about this in our study club that is called Comprehensive Treatment Seminars, study club, and last 20 years we have been talking about this. And this has been our protocol, rehabilitation of pharyngoorofacial system. Now, and we have been such a blessed and lucky that we have pioneers like Dr. Steve Carlsonson in our study club, and finally he got the spread the message worldwide, and this guy changed the history of dentistry. Steve Carlsonson should be his name should be stamped in the future, that he spread the word and made ADA now approving the fact that we need to be worried about the airway of our kids. That is changing, environment is changing. And the other thing that has been added to it is enormous amount of calories and commercialism that is bombarding these minds of the kids with the ice cream and high consumption of the sugar. That's another factor that added calories and increased volume of soft tissue and the bones and teeth that are constricting, because of the softoid and everything else, has been creating significant what we call discrepancy in the health of this young, what we call population of the kids in the United States. For the first time, 1/3 of population of our youth in these civilized countries like United Kingdom, Australia, and Canada, they are going to live shorter lifespan than their parents, because they are suffering from metabolic syndrome, and unfortunately this significant amount of high consumption of the sugar and high calorie hamburgers and these French fries is adding to the problem. So ADA finally accepted the fact that something is a problem. So they invited us on the 23rd of the August 2018. They called for what we call opinion leadership participation. Guys like me that they have been talking about this, and what we call leaderships like Dr. Gonzalez, David Gonzalez, like Dr. Gimino, to go to the ADA headquarters with the presence of the trustees from American Orthodontic Association, American Dental Association, and ask us to come up with guidelines about children's airway health, which was a pleasure and honor. So we came up with some guidelines that is going to be very soon, and in near future is going to be in kind of routine for screening in our dental offices and orthodontic offices. As much as we are screening for cavities, we are screening for the health of the airway of our kids.
So let's get into that. Now, as a practitioner, I am responsible, good oral care, to look for caries in my patients. If I significantly miss, I am legally responsible. What this conference has started to, now that this conference has taken place and the ADA is now starting to feel as though there is a significant problem, we are becoming legally responsible for the diagnosis of at least obstructive airway with children and our patients.
Exactly. So let's think about it, Ed. Just missing one cavity in a kid, well, is going to lose that tooth, but at the same time missing the airway of the kid, that now we know that this can create airway issues, can lead to ADD, attention deficit syndrome, hyperactivity syndrome, and what we call bedwetting, educational discrepancy, not doing well at academic performance. Those are more critical, life-threatening situation than one cavity and losing one tooth.
Yeah.
So I think that we are in the environment of the mouth, and now pharyngoorofacial system and pharyngeal airway, and nobody, as the guidelines of the what we call American Dental Association is describing, dentists are the most qualified clinicians for management of the airway, because it's right in the environment that we work on, except that it's not orofacial or dentofacial anymore. So that's why we need to learn about
we have to expand our horizons to start looking further back into the airway and the pharyngeal areas for diagnosis.
Exactly. And then you know what? This is there are rumors and bad feelings also that, well, dentistry is not doing very well, and we are overpopulated, and dentistry becoming what we call not lucrative. Well, how about we open up another revenue way of the new income for dentists? Now dentists are not tooth fairy or tooth doctors anymore. We are saving lives. Medicine is our biggest alliance, and medicine by itself cannot do that much. CPAP is fine, great, but put a CPAP on 5-year-old or 10-year-old kid is not possible. But as orthodontists that is trained to look at the airway and expand the airway, every dentist in this country, in the world, when they graduate now, they need to have ample knowledge about science, purified science of orthodontics. That is called, I call it teledontics, call it some other name, but they need to know how to expand the jaws, avoid extraction. Instead of pushing the jaws back, actually inviting the growth of the jaws away from the base of the skull. So every dentist in this country needs to graduate with that. It should be, now we don't want to ruin the specialty of orthodontics, but these guys now, they need to think about something advanced, something that is not ordinary things.
I always compare it, Joseph, to doing endodontics. I, in my practice, do conventional endodontics in my practice, but when I see a molar with tortuous roots, I send those to the endodontist to complete.
Exactly.
I can do the easy ones. The hard ones, that's their specialty. It's the same as wisdom teeth. I can take a tooth out, but when it comes to an impacted third molar, there are specialists that do this much better than I. And I always practice the way it would be if that child were my child. What would I do if this were my child? Just because it's not going to cost me anything if I did it doesn't mean it was done the right way. So I think that we have to have not just the monetary aspect of what it can do for our practice, but we have to put the patient's health in our hands and do the best thing we can do for them to have a healthy life ahead of them. And I think that I got that out of your lecture.
Exactly.
That really, really helped me understand how important that was. Do something for me. I know the way your lecture started, you talk about a young man called Ryan, and you show all of the signs and the symptoms and all of the problems that this young man had. Tell me how you ended your lecture.
Well, the thing is, Ryan, had very interesting life. Ryan at age 11, 12, 13 has significant what we call hardship in his health, was obese, doing very poorly at the school, and not being socialized. And we waited till age 16, 17. Of course, that was a mistake and misunderstanding of what is happening to Ryan. So we had a backup plan when Ryan got to age 17, 18 now. As a what we call backup option, we brought jaws forward, and we did the telegenetic surgery. Jaw came forward, and then Ryan changed. That changed the life of Ryan. Ryan became smart again, Ed, and this is amazing. And because when kid cannot sleep and the memory is lost and cannot use the analytical part of the brain, they call him dumb at the school now. So Ryan became a different person. Ryan, that they told him at one point that is not qualified to go to higher education, he attended higher education and graduated with honors. And now Ryan has his own startup company that is offered to be bought millions of dollars. Ryan, that was dumb. Ryan is my son, and I suffered through that. and Ryans, there are significant number of Ryans all around the world. Sleep apnea is a pandemic. We need to understand it. And it's not like a pandemic like AIDS pandemic. Unfortunately or fortunately, it's a chronic problem. Gradually decrease the lifespan of the affected population. And as a dentist, cooperating with our colleagues in medicine, it is going to significantly save the lives of Ryans around the world. We need to look for Ryans in our practices. They're all over the...
They're all over my practice. They're all over my practice.
They're coming to you. You're looking for cavity, but look for their airways, that how you can expand it. You are going to change the lives of these Ryans. These are the Ryans that right now 1/3 of population of this country, there are Ryans that are suffering from this disease, and we call them dummies, and we are dummies, and we call them chubbies, and we exclude them from the environment, and is a discrimination and as against weight and this population, and we make them living shorter with very what we call unhealthy lifestyle. We can change this. Ed, you and me, we can change that.
I'm convinced of that, Joseph, and I got to tell you, that's watching the pictures change from when Ryan was young to his graduation from college. Most impressive I've ever seen. The audience in your lecture, their jaws dropped when they saw what you did. Wonderful. Anyway, I want you to just take a few moments and help our audience know what are the things you look for when a patient comes in that you should be focusing on, the questions that you would ask to see if you can help diagnose a child with obstructive sleep disorder.
So it's very simple, Ed. Right now, we are, every dentist is required to do infection control. They come in, you have questionnaire. Do you have, sexually transmitted disease? Have you been, do you have this? Do you have that? And you want to find and screen the ones that are high risk, patient. Mm-hmm. It's the same. It's very simple. Now, at ADA, we came up with a kind of a little bit of watered down strategy. We call it Snore Plus. Does patient snore? If does, then ask 5 more questions and find them. Actually, we can do 22 questionnaires that much easier. We give them how does the child snore, sleep is comfortable, how they are doing at school. There are 22 questions that is developed actually by Michigan and is very effective. Is the way to find them. If they score 33% positive answers to these 22 questions, then we find out that this patient is a red flag that may have some developing of some airway issues. Either doesn't sleep enough or maybe suffering from initiation of the obstructive sleep apnea.
So let's go through some of those things. You mentioned a few, that they would snore, that they grind their teeth, that they may have other developmental problems in school, that they're falling asleep in the classroom, that they have difficulty getting up in the mornings. Those that drive sometimes will fall asleep waiting. Bedwetting is one of the big ones right there. Exactly. Bedwetting.
Yes.
So these are the kinds of questions that I think every dentist, and as a pediatric dentist, I would say every pediatric dentist should have those questions on their questionnaire and screen these kids for obstructive airway.
What a nice field, pediatric dentists. You guys, you can do wonders about the life of this, because you see them at age 2, 3, 4. And you know what? Now we need to give you some, guidelines about screen them and give you the appliances that you can treat them right there. As soon as they have primary dentition, you can expand their jaws and get them right. Now, the question then, what we do with them. So the proper way to what we call diagnose them, then you are going to put them in hands of, send them for the evaluation to a sleep doctor. Unfortunately, American Academy of Sleep Medicine, they need to understand that we have just 300 sleep specialists that are board certified in the area of the pediatric. We need to have much more of that. American Academy of Sleep Medicine, they need to ease up on making it so difficult to become board certified in the area of pediatric. They need to increase number of those, but for time being, there are some other home sleep studies like NOX3 and similar to those that we can use as a screening, system. Cool. It's very, easy. It's a little bit expensive, but you can, it is.
But still, the most important thing is doing the screening, finding out that they have the problem. But unfortunately, medicine doesn't have the answer. It's falling back to the dentist to do something to help these children at an early age. What can the dentist do at an early age?
Well, let's put it, medicine has some, impact. For example, if they have large tonsils and adenoids, they need to come out. Yeah. They have very huge, issues, that is obstructive. We need to do that. They need to help us. So it's interdisciplinary medical dental. It's not just dental. So that's why we need to have close relationship with our, with physicians also. Now, but as a dentist, what we can do, simple, breathe through your nose. That, training your assistants or training your hygienists to, get some training in myofunctional therapy, train them to bring the nose is a great service. It's very easy. You need to charge for it, and that is the beginning of, a great, what we call treatment protocol. And then as, we need to know that even in the most remote area of the United States or world, we need to give the appliances that can be bonded to the teeth and expand the jaws of these, kids. Not the dental expansion, but I'm talking about skeletal expansion, that the nasal cavity is going to be expanded. Avoid procedures like, pulling teeth. Even the baby teeth should not be pulled unless you put the space maintainer there. Preserve dentition because those are the support for the airway and pharyngeal, airway. And then, when time comes, take advantage of the growth period that they have, significantly expand the jaws, and wait till the lower jaw grows properly. So
let me stop you right there, just 1 second, because there is a little bit of a controversy in the world. Many very astute growth and development practitioners and educators have always said you can't get the lower jaw to grow forward unless you expand the upper jaw.
Absolutely.
Okay.
Absolutely.
So that flies in the face of others who feel as though that you can ignore the constriction of the upper jaw and still advance the lower. I have not seen that. The treatments that I provide for my patients when I do expansion therapy, every case that I've ever done, and I've done 4,000 of them, if I expand the upper, the lower jaw naturally grows forward without any rubber bands or anything. It just naturally comes forward.
You're talking about the research that Dr. McNamara did in Michigan.
Exactly.
And they noticed that if you go transverse first, get the maxilla widen, the mandible has room to grow into the maxilla. At the present science, we need to have patience. We need to let the mandible grow on the, so make the joints healthy because those are the growth centers.
Let me tell you how I explain it to my parents. I suggest to them that the mother, if she has pointed high heels, that her toes do not go all the way to the front of the point. But if you expand it and put on tennis shoes, your toes go all the way to the front of the shoe. So consequently, they can understand then that if you have a narrow upper arch, you're not going to be able to get the jaw forward in the correct position. Like the pointed high heel, they have to have a tennis shoe, and that's why we need to expand.
I need to use that in my practice. Tennis shoe example. Yes, exactly. I agree with you. So, and then we wait, sometimes we need to age 14, 15, and 16 till the lower jaw catch up. And we do that. We are going to significantly avoid surgeries. Surgeries sometimes are necessary, telegenetic surgery, But at the same time, we need to have patience.
But if you have to do that telegnathic surgery, then we basically have failed in diagnosing it when they're young and providing some treatment so they don't have to go through telegnathic surgery.
So telegnathic surgery is backup option. Today this backup option is used just 10% of the population, or what we call adult patient that they never had the opportunity to get this treatment.
Correct.
But as a pediatric dentist or the dentist equipped with this science, you can avoid creating the issues that patient develops, what we call airway issues in future, and we are all for children airway health.
Joseph, let's stop here and have a word from one of our sponsors.
Hi, my name's Dr. Brad Williams, and I've practiced orthodontics for over 35 years, and over those years, I've had some fantastic teachers like Dr. Bill Wyatt, Dr. Bob Garrity, Dr. Dave Jackson, and many, many more. And I'm honored now to be teaching orthodontics to a whole new generation of general and pediatric dentists. I want to personally invite you to enroll in one of my basic or intermediate hands-on courses through the American Orthodontic Society. We are committed to provide your entire staff the support and training you need to launch orthodontics in your pediatric or general dental practice. And to make the hands-on experience in my classes the best possible, I've partnered with an outstanding and very ethical company called OrthoArch to provide all the orthodontic supplies my students need. When my students start treating patients in their offices, they too will benefit, as I have, in partnering with OrthoArch for all their orthodontic supply needs. You can contact OrthoArch at www.orthoarch.com. See you in class.
Tell me where you think we're going to be in 10 years.
In 10 years, dentistry, the new dentists are going to be so comfortable and proud of themselves that they are saviors of lives all over the United States. And there are going to be shortage of dentists that they are going to be able, to do this type of. So the way that I see it, dental school is going to start teaching dentists a lot about the purified science of orthodontics, and I call it teledontics. Call it whatever that you want to tell it, but at the same time, be able to use this science for expansion, not constriction, developing the jaws. So dentist is going to have educate with the ample knowledge about health. So we are going to create medical and dental doctors. Dentists, they are going to know a lot about the airway, about systemic health, because pharyngofacial system is what we call key point and the passage for the health of systemic health.
We are, as physicians and dentists, we are, I want to say it the right way because it may be confusing, but people go to us when they have a problem. What we need to do is help them stay healthy.
That's right.
You go to your pediatrician when you have an earache or you have a throat infection, and you're not really thinking about the foods that they eat, the nutritional education that the parent needs. Those are the kinds of things that I'm afraid that we don't have the time, that we need to take the time to educate our parents about this.
So the thing is that you asked me that what the future dentistry is going to be. So the future dentists are going to have ample knowledge about the whole knowledge about the body and health of the body. And we sometimes we discard the information when we graduate, never look at the medical science that we learn, because this science is mind-body wellness. Is not just a sleep apnea, it's the whole day oxygenation, is food, nutrition, positive thinking. And this is going to be a branch of medicine in future. Dentistry is not, we are not just bunch of tooth doctors, we are what we call physicians of pharyngofacial system. So we know that how develop it, how protect it, and that is going to make this system that is responsible for breathing, chewing, swallowing healthy for life. We save lives.
We save lives. We save lives. What's the estimate right now that if you do have, let's put it in perspective. What is the estimate right now that if you have severe sleep apnea, what's your life expectancy?
2030 minus 20 to 30 years shorter lifespan, because sleep apnea is what we call silence killer. there is a reason, and I always said it, that our nature and the universe is the best architect. God created sleep and advocated sleep for a reason. In sleep, you regenerate yourself. You need to go to deep sleep to have a long-term memory, and also in delta sleep, you need to regenerate yourself, repair yourself, fight against the infection, against bacteria, cancer cells, in activating immune system in the delta sleep. You cannot sleep; those are going to be defected. As a result of that, the health is not going to be satisfying for long spans of life. You may live long, but it's not going to be healthy and fulfilling life.
That is the reason I asked you that question, is I want our listeners to understand their responsibility. Their responsibility is to diagnose this, because to think that if you misdiagnosed this or didn't care about this, that you would literally be taking away 10, 20, 30 years of life from your patient, is you need to have the responsibility to educate them and teach them and do something for them so that they have a nice long life. I really think it's important that our audience understands their responsibility, and that this is going to be a very important part of dentistry in the future. And we'll be working with the medical community to try to find a cure for this. And you've already started working on some appliances that might be the cure. Tell us about that.
Well, all these appliances are for the expansion of, again, this environment, pharyngofacial system. And this should be very, very easy. The way that, avoid cavities. These are very simple expanders that even a simple dentist back in, tribes of the African can use it and expand the jaw of the kid that's traveling from one of these tribes to his office every 6 months. Avoiding cavities, expanding the jaws, give them the opportunity to do that, and creating functional appliances that, developing functional appliances that they don't have headgear effect. So it means that let the maxilla expand it, stay forward and grow forward, and then encourage the lower jaw by wearing them at nighttime, nurture the joints, and this functional appliance with the new technology help the lower jaw grow without impacting the proper growth of the upper jaw. Those are the appliances that is coming in market. We are just waiting for what we call the companies that they can do it in mass production, and then I am going to be in service to share this knowledge of the teledontics and telegenetic protocol that now is published at the what we call Johns Hopkins University, and researchers and scientists, they came and validate this. There is a book that is published. It's called Orthopedic Therapies. Is the metabolic therapies in orthopedics, and the science of teledontics has been what we call introduced as emerging therapies for the maintenance of health. So again, validated by 35 scientists, authors that they are PhDs, Nobel Prize nominees, and also American Academy of Sleep Medicine also understood this protocol, then telegenetic protocol. So it's a valid protocol for treatment of sleep apnea, even the most severe form of sleep apnea. But we need to make it simplified and make it handy to every dentist. You don't need to be orthodontist to do this complexity. You know what, Ed? You need to be honest. Open your TV and listen to it. This, unfortunately, what is called a Smile Direct Club. They say that orthodontists are not needed. Now orthodontists need to get severe. As the first specialty,
a dentist is not even needed.
The same. As a first specialty, the most valuable discipline, they're out. They say that they're not needed. You don't need orthodontists and dentists to straighten your teeth. We are not going to be just making straight teeth. We are going to expand the environment that health and oxygenation depends on that.
And your life depends on it. Your life depends on it. Joseph,
quality of life.
Absolutely. Joseph, thank you so much. You've enlightened us all. I mean, we've got a big audience out there that listens to you. You've told your story, and it's remarkable. And I hope that your 10-year prognosis of this will be true, and that dentistry will take a hands-on approach to the correction of pediatric and adult sleep apnea. So thank you for being on our show.
My pleasure.
This is your host, Dr. Ed Gonzalez. I want to thank you for listening to Orthodontic Smiles today. If you enjoyed our broadcast, please click the subscribe button. We'll be in touch with you in the future about our further broadcasts. Thanks for listening.